So, hello everyone. Welcome to this webinar entitled Global Health in the Field, Youth Voices. We are very happy to see that you didn't get any allergy to online live and that you are thus able to join us here virtually. So thank you so much. This webinar is organized by the Global Health Young Professionals Initiative, GHYPI. So I am Imane Idrissi. I am a molecular biologist and former student of the Master of Science in Global Health. I am part of GHYPI and currently working at the Foundation for Innovative New Diagnostics. I will be moderating the event together with my colleague Lacye Groening. Lacye, could you also please briefly introduce yourself so that everybody is familiar with the two of us?
Hi, good afternoon, everyone. So my name is Lacye Groening and I studied global health here in Geneva. I'm now involved in GHYPI and I also work at the International Labour Organization, focusing on occupational safety and health, particularly effects of the COVID pandemic on workers.
Thank you, Lacye. So before I give the floor to the Secretary General of GHYPI, I just would like to remind you that after hearing all the talks, we will have a short discussion. So we highly encourage you to share your questions or comments in the chat, and those will be voiced by Lacye and me during the discussion. So in a few seconds, Morgane will be speaking. She is the Secretary General of GHYPI. She has a background in political sciences from the University of Lausanne. She is also a former student of the Master of Science in Global Health, and she is currently working as a policy analyst at IFBMA. So Morgane, the floor is yours.
Thank you very much, Imane, and good evening and welcome everyone to our GHYPI event. So on behalf of the whole team, I would like to really thank you for joining us, and we are delighted to have maintained this event that was supposed to be part of the Geneva's Forum before COVID-19 disrupted our lives. So I will briefly present the initiative. So the Global Health Young Professional Initiative started in 2018 and brings together alumni and current students of the Master of Global Health from the University of Geneva. So we are inspired to lead a platform for students and young professionals in the field of global health to share innovative ideas through workshop and panel discussion, embrace networking and mentorship, and also host creative events that connect young global health professionals, students, interns with experts. So we are truly honored to have with us today amazing speakers from different fields and origins, and I'm sure we'll have an engaging discussion on all of your area of expertise that have a direct impact on health. So complex issues such as access to medicine or climate change are very sensitive and political issues. And I believe we should always address those keeping in mind the global public good. The current state of politics that defines those issues is not very positive at the moment, but we as a leader of tomorrow, we have to think differently and believe in our capacity to change the course of things. So I would say really let's speak our minds on those issues and think of new ideas and new ways to address those problems, to not remain always in the same old status quo that we have these days, this current time. So thank you, that's all from my side, and back to you, Imane.
Thank you so much, Morgane, for the great introduction. So our first speaker will be Bitania Lulu Berhanu, who will be discussing the need for youth-led and youth sexual and reproductive health initiatives. Bitania is passionate about youth and gender inclusion in public policy and is currently working with AMREF Health Africa.
Okay, good evening, everyone, depending on where you are. Good afternoon. I am unable to open my video because I don't trust my internet, but I hope I'm audible enough. So my name is Lulu Berhanu. I'm an Ethiopian. I am a 26-year-old youth advocate for youth inclusive policy, be it ranging from governance to health to youth development. So today, because it's a health professionals platform, I will be sharing one of the things that I do. I chair the Youth Advisory Parliament for AMREF Africa. Given that most of you are from the health sector, I assume that you might know AMREF Health Africa, but I would still give you the overview of AMREF Health Africa. It's a global health organization, NGO in Africa focused on health. So the vision is lasting health change in Africa. It's set up to improve the lives of disadvantaged people in Africa through better health. It bridges gaps between communities, health systems, and governments. It is a leading force for advocacy for health systems and reforms in Africa. And the mission is to increase sustainable health access to communities in Africa through solutions and human resources for health services, delivery, and investments in health. So AMREF Health Africa is situated across Africa and Europe and North America as well, as you can see. And the Ethiopian one has been in the country for about 60 years, but it was officially registered in 2002. And it implements lots of projects that are, and general background on youth. Globally, we young people have the biggest demographics, and undoubtedly we're the most important agents for positive change and for sustainable development in the continent and across the globe. And 1.8 billion people aged between 10 and 24. So a quarter of the global population is young people, and 9 in 10 of us live in low-income countries. And Ethiopia specifically, young people make up 70% of the population. So being on a point which makes the health and welfare of Ethiopian adults and people a great important. So that's why we created the Youth Advisory Parliament to support the leading global health organization to ensure that all the projects are designed and implemented with and for young people. And it's comprised of leaders at the age of 30. And when we speak of public health, we don't really necessarily need to engage help of everybody. So we have lawyers, we have medical doctors, pharmacists, and me, a development specialist. I'm an engineer as well. I did my undergrad with electrical and computer engineering, and then later shifted to youth development and did my master's in global studies and development. So we have incredible prominent young leaders to ensure that youth inclusion is at the core of this global leading organization. Our roles is basically to act as an advocate for issues of adolescents and youth. We represent the voices of young people. We advocate for meaningful engagement of young people as role players in policy and program development and forums. We ensure that there is youth participation in national and regional dialogues. And also we support project implementation periodically. And we also have mandated to establish regional and district level advisory team to ensure that all projects from top to down, nationally, internationally, and locally, they're led and centered by young people. So just to give you an overview, when we set up the team, we had 5 main plans. The first is to increase meaningful youth engagements. Of course, we have a lot of leading organizations saying that they're working for young people, but are they really ensuring that young people are included from the very development of problem identification stage all the way through to the implementation? And they should also be involved in the monitoring and evaluation stage. So we continue to increase this by ensuring that young people are at the core center of the projects. And we, by ourselves, designed a COVID-19 response project that was implemented by the National AMREF Health Africa and Ethiopia. So this is the full representation of young people leading projects and leading change. The second thing that we set as an action point was regional youth advisory parliaments, and in that we kind of tried to set up, Ethiopia is kind of divided in 10 regional states. So now we've covered about 3 of them to set up outside of the capital, to set up the different youth advisory parliaments to ensure that rural youth are also represented. Of course, we've tried to set up conferences and trainings to empower young people. Of course, but with the COVID-19, we were kind of slowed down on that aspect. The 4th action point is interactive educational materials. So we came up with very creative and innovative ways to teach young people of their sexual reproductive rights and health. Because AMREF has they have built a lot of youth-friendly services across Ethiopia, and for them to use these creative and engaging health education materials, we designed it by engaging youth digital artists. The last one is collaboration with AMREF country branches and scale up IAP. We have been in touch with all the Northern American and European country branches to ensure that we have a replication of something like this in other country branches as well, because this was originated in Ethiopia, but AMREF is a global health organization, and they work for young people, and we're trying to disseminate this information and also repeat and have the same platforms in all the country branches, which we have tried to achieve. These are some few pictures of our engagements in the past year before Corona. And I would like to share one quote that was shared by our program director. It says that we cannot always build the future for our youth, but we can always build our youth for the future. So this is to just shed light of the importance of including young people and empowering young people for sustainable development. These are other picture representations of what we have done. We have an ending female genital mutilation and gender-based violence champion from our group. And this is the COVID-19 response. So we designed to counter the negative impacts of the pandemic with a community outreach street sensitization program to teach proper prevention methods of COVID-19, to create lasting behavioral change, and to curb the rising numbers of sexual violence as well. So we went around Addis, and this was replicated in other cities of Ethiopia as well, with the advisory parliaments that we set up in other regional states. So we managed to do that and to teach people in order to prevent the spread of the pandemic. And we also developed a digital capacity building program because of the pandemic. Of course, schools are closed, universities are closed, issues are raising. So in order to curb that, we people to use this newly propounded time, stay on phone time, and also steer timely discussions and dialogues via selected radio stations, social media, and how to use the newly found time effectively for personal development. And we provided insights on mental health implications caused by the self-isolation and different reactions taken to COVID-19. So these are the basic things that we have done. There's one project that we're running with our countries in Netherlands, and Ministry of Foreign Affairs in Netherlands is funding the project that's being run in 7 countries: Ethiopia, Kenya, Uganda, Malawi, Ghana, Senegal, and Indonesia. And our youth advisory parliament is in the lead youth design program to ensure that it's a 5-year project that makes sure that young people are at the forefront advocating for their rights, and also going all the way to the grassroots level to ensure that all the problems are captured well, so that we can come up with better solutions. So this is what we basically do as a youth advisory partner, that meaningful youth engagement is absolutely important and crucial. It's not a matter of favoring young people, but it's absolutely important because they make the majority of the population. And without their say in the Sustainable Development Program, we will not reach the SDGs in 2030. Thank you very much.
Thank you so much, Bitania, for this very interesting talk. So we are really looking forward to the discussion after. Now, the floor will be given to our next speaker, which is Pierre-Antoine Legrand from the Swiss Youth for Climate. He will be talking on climate change and youth engagement. So Pierre-Antoine has a background in economics, political science and international relations from the University of Western Australia. He also studied environmental studies at the University of Geneva. He worked at Ethos Foundation as a sustainability analyst, and he's currently working in energy planning and sustainability. He is also an active member of the Swiss Youth for Climate. Pierre-Antoine, thank you so much for joining us. It was a very, very strong request from people from GP. We really wanted a speaker to talk about climate change because we usually forget that it's also a global health issue. So thank you so much. The floor is yours.
Hi everyone. Thank you, Imane, and thank you to GP for inviting me. So yeah, I'm going to try to talk about what we do as representatives of Swiss youth. So as a start, I'd like to think quickly about the links between health and climate change. So I think the most obvious one that we kind of see a lot and pretty obviously is kind of air pollution. But actually I think it goes beyond that, and I'm also looking forward to the discussion because I'm not an expert on health issues and so maybe I could learn a couple things. But also I think, for example, migration is going to be something, a trend that is going to be really strong and reinforced with climate change. For example, I'm thinking about refugee camps where spread of diseases can be a really tough challenge to crack. Then there's, for example, emerging diseases. For example, just top of my head, those occurring after land use change, or for example. Yeah, I think that's pretty much it for that. So Swiss Youth for Climate, what motivates us is the kind of existential and climate crisis that we are living, that will require some kind of urgent and unprecedented action. Of course, youth is going to be most affected by the decisions or lack thereof that are being taken today by our leaders. And we also have kind of a moral obligation to take part in the debate. So this is the reason why Swiss Youth for Climate was created in 2015 to kind of represent the voice of the youth of Switzerland at international climate conferences. So it was funded in 2015 to join the now famous COP21, which ended in the Paris Agreement. So the founders noticed that actually civil society was invited and always present at these COPs, but that youth was underrepresented, and in particular Swiss youth had no voice there. So this is pretty much our reason for existing. What we demand is, first of all, that at the national level, so in Switzerland, that the climate emergency be declared. So at the national level, maybe some of you know in Geneva and some other cantons, it's already been declared, but not at the national Swiss level. Second, we want to reach net zero emissions as soon as possible, and for us that means 2030. And also one thing which is really important is to achieve climate justice. And I think that climate justice and health issues, for example, I was talking before about refugees and migration. I think these two issues are really closely linked. So all of this really requires bold action, science-based bold action on all the levels, meaning the international level, the national level, and even the local level. And these are actually the 3 levels where we are active. So I talked about our involvement at the climate conferences, but we are also active kind of nationally on a lobbying kind of, I don't know how to call it. We're not official lobbyists, but we get in touch with our government, and we kind of try to expose our view representing Swiss youth and the interest of the young people in Switzerland that is currently underrepresented in government. So yeah, we try to advocate for this ambitious and bold climate policy. And the 3rd level is the local level. So we are active in 6 cities of Switzerland in all 3 language areas. We have about 300 members. Yeah, and so what's our vision? We want to achieve kind of, I know it sounds a bit corny and a bit idealistic, but we're young and we're still able to kind of dream, and if we want to project ourselves into the future, I think it's always something that's, you know, we should be we should be optimistic. So I'm optimistic about our ability to be able to live in harmony with nature, and I think that will come through an empowered youth generation that is able to affect the current decisions that are taken at the top levels of climate action. So regarding our international involvement, as I said, we're involved in climate conferences. Concretely, how does this happen? We send a delegation of about 10 people each year. This year it has been postponed, sadly. It hasn't taken part by Zoom or something. It has been just postponed for 1 year. But for the last 4 years, we've sent a delegation of about 10 people during the 2 weeks of the COPs. So the first week, there's always more kind of technical discussions, and as a civil society, we're able to observe what's going on, and we're able also to ask questions to the Swiss delegates who are actually representing the Swiss population. So it's our right to ask them questions. And so in the last 5 years, we've kind of developed a relationship with them. And the last year, one of our members was invited to be part of the official Swiss delegation. So she was able to negotiate as Switzerland at these climate conferences. And this is really interesting. And I think this is one way which could be replicable to any sort of international negotiation where youth can actually make a difference and have their views heard. The other level, which if I have some more time, I'd quickly like to dive into, is our kind of national lobbying efforts. Bitania, you were speaking about the Youth Advisory Parliament, and I think it's actually a really interesting idea and something that maybe we could also expand on, because our strategy has been a bit different here. So we've kind of taken a one-to-one approach where we send an email, we telephone or whatever, try to get in touch with a parliamentarian. And this has been done in the context of the revision of the CO2 law in Switzerland. So this has taken place in the last 2 or 3 years. The actual law is being revised, and there's a lot of discussion, there's a lot of debate. And where we try to influence this is that we try, for example, to say, okay, you should, for example, integrate a tax on air travel. And actually, one of the parliamentarians who we had contact with told us, okay, why don't you just suggest an amendment, a law article about a tax on air travel. So we had to kind of, it was a fun exercise to calculate what was a fair price and taking into account all the mechanisms that had to take place. So yeah, I think I can conclude here. Oh yeah, just one last thing which I wanted to talk about. We're not really involved in strikes and those big demonstrations that are taking place in the kind of climate strike movement. But we're all for it, and we think that this is a good way to actually be heard. We think it actually works, and I think it's a good idea for youth empowerment to demonstrate, to be on the streets, because if we cannot be heard with political means or just sending emails or going to negotiations, we can always be heard in the streets. And the fact that in a lot of countries, youth is also a majority really speaks to the real power of youth, as opposed to leaders who are maybe old and decadent.
Thank you so much, Pierre-Antoine, for that great introduction to Swiss Youth for Climate and for just outlining all of the bold actions that are really needed at the local and global level for climate change.
You're welcome. And the last thing I would like to add is that we're actively recruiting. So if you want to have a chat after or just ask Imane for my email, I'll be glad to introduce you a bit further to Swiss Youth for Climate.
Great, thank you so much. So our next speaker will be Solveig Kemna. Solveig was trained as a medical doctor and is currently working on COVID-19 in Berlin and has been involved with the university's Allied for Essential Medicines, which is a student-led movement for 4 years. Solveig will be discussing access to medicines and how youth can get involved in this movement.
Hi everyone, and thank you so much for the invitation to speak on this event. It's such a great opportunity to talk about these really important issues, and I think youth empowerment is so important that, yeah, I think it's really great that I have the opportunities to speak here. So first I would really like to quickly introduce UAEM to you guys, to everybody who doesn't know the organization. UAEM stands for Universities Allied for Essential Medicines. And we are a student-led NGO, a grassroots NGO, which was founded in the late 1990s. All around it was founded in the US around the HIV/AIDS epidemic, which was becoming actually at the time a manageable disease in the developed world due to new antiretroviral drugs. But in poorer countries, millions were still dying because of AIDS. Because just the new treatments that had been developed were just too expensive. And at the time, there was a law student at Yale in the US who discovered that one of the new medicines that was developed for HIV/AIDS was now being sold by a pharmaceutical company that some of you might know, Bristol Myers Squibb or BMS. That was originally discovered actually at Yale, so at the University of Yale. And together with other students and with the support of the researcher who had originally discovered the drug, she actually asked Yale to drop the price of the drug to make the medicines available to those who needed it and who were just not able to get the treatment they needed because of the high price tag. So at first, Yale replied that they couldn't do anything about the price, and because they, although they owned the patent, Bristol Myers Squibb, so the pharma company, had been granted an exclusive license. So they were the only ones that were actually allowed to manufacture and sell the drugs. So Yale wasn't really able to do something about that. And they, because of this exclusive license, they had the power to set the price. So what you would call a monopoly. But then after a lot of public pressure and media attention in the late 1990s, Yale and BMS finally agreed to allow the import of a cheaper and generic version of the drug, of this antiretroviral drug in sub-Saharan Africa, which actually allowed people who really needed the treatment to access it, even though, because it was just a lot cheaper, because the actual manufacturing price was much, much cheaper than the price that was initially put on the drug by the pharma company. So this initial fight that really is at the core of UAM's work showed the students at Yale that universities as public research institutions are really important actors in the access to medicines crisis, and that they can also play a part in making medicines available for everyone. So this student, she joined together with some other students and started UAM with the goal of preventing the same thing to happen again with other diseases or other drugs. So one of the core ideas and projects of UAM is to put pressure on universities to have them implement rules for how they license their inventions or their intellectual property. So in order to ensure that university-discovered drugs that are also funded by public money would become available to those who needed them most. So that's kind of the initial founding story of UAM and kind of gives you an idea of what we work on as an organization. So now, currently, why is still access to medicines? Why is that an important issue? In Europe, but also worldwide, the price of new medicines is rising year on year, and especially if there's no therapeutic alternative. So if there's just one company able to manufacture and sell a drug, that's probably going to be a very, very expensive drug. And as a result of that, treatments for life-threatening infections and diseases like, for example, HIV/AIDS, but also cancer or hepatitis C, are increasingly unaffordable for individuals, but also for national health systems. And this is the result of an ineffective and really costly research and development system that, that kind of incentivizes research and development by giving fixed term monopolies or patents, and therefore encourages unaffordable price setting. And this allows pharma companies to charge really high prices that are really unconnected to the manufacturing and development costs of the medicines. And we really believe that measures need to be taken to reinvent and redesign the whole research and development system of medicines. Just on the one hand, to make them more affordable and more accessible that way, but also in order to incentivize research and development for diseases that are important on a public health or global health from the global health perspective. So now looking more closely on what do we do at UAM, what is our what do we work on specifically? On the one hand, so we have three areas of work or where we focus on, which is on the one hand, access to medicines. So that's kind of what I was talking about before, high price setting, the whole process not being transparent, the big imbalance between the private pharmaceutical sector and the public sector, for example, including universities, but also all of the public funding that goes into the research and development and manufacturing process of pharmaceuticals. But then on the other hand, also innovation and just kind of trying to target diseases that are important from a global health perspective and not from a perspective of the shareholders of pharma companies. So thinking about, for example, neglected tropical diseases that impact a large and very, very important number of people, but where there's just no research is being done because it's just not a like from a marketing perspective, it's just not, there are no incentives to conduct research in this area on NTDs. But on the other hand, also, for example, antibiotics, that's also a really good example of if you think about what incentives do you have for innovation that's you want as a pharma company to have a high return on investment. So that means you want something that you want to invest in the development of a drug that will be able to that you will be able to give your patients for a long time, that you can give to patients that that have that goes to a high-paying demographic. But then if you think on the other hand about antibiotics and how you should use them and how you should employ them, it's actually really important to employ them sparingly and to be careful about when you use them. And I mean, just thinking about antimicrobial resistance and what big problems it causes us currently in the health system, it's really important to create new incentives, because you don't want to give out. You want to minimize the use of antibiotics to curb the problem of antimicrobial resistance. So yeah, that's the other focus point of our work, just to try and create different ways of innovation that meet global health needs. But then I think most importantly, UAEM is about empowering young people. It's about empowering students, about empowering people that find an issue that's really close to their heart and that they want to do something about, but sometimes maybe in the face of, I don't know, like the system in general, it sometimes seems like a very daunting task. But we always try to foster the message that the students, we're a grassroots organization, and they are really like it's the core of the work of UAEM. It's led by students, and they're the key players. So they're the ones that are at universities, and they can directly influence the universities. They can directly influence researchers at their universities, for example, and they can try and influence universities on how they conduct research, and in the end also what happens with the results of the research conducted at the universities. So what happens with IP, what happens with the public money in the end that's being spent at universities as public research institutions. So that for us is really, really important, to just kind of put the youth at the center of our work. And I think that also gives us a very strong voice, which is, I think it makes our message much more authentic. And so we have different campaigns going on. I mean, at the moment you can really see, I mean, the COVID pandemic is just really shows how access to medicines is just more important than ever. It's just an issue that's always been important, and now everybody just sees, okay, we need to have mechanisms in place that help, a fair distribution, a solidarity in distribution and manufacturing of medicines. That it would be better if you shared IP, if you shared research findings, that to just have a global coordinated response to the pandemic. And we can see that if you don't have access to therapeutics, if you don't have access to vaccines, if you don't have access to also protective equipment, it just shows that just life as we can't know it can really go on. It's just not possible. It impacts us so directly. And I think kind of looking or maybe sparking a point for the discussion afterwards, what I think, which is kind of a very concrete observation that I've been making throughout this year, in this very special situation. I mean, I think it's great that we are having this webinar, even though we can't meet in person, we can still have these discussions. I think it really shows the importance of all of these issues that we've been talking about, and I think it really shows the importance. And I also think for us as an organization, it really helps recruit new members, because it's just so blatantly obvious how important it is, and people are very motivated to do something. But on the other hand, I think it's also very difficult at times, or quite challenging at times, if you don't have the possibility to meet in person, which is, I think, always very, very helpful and very motivating for students to get together, to share their thoughts and their time with like-minded individuals that mobilize around the same cause. And that really helps us build momentum. And I think that's a challenge that we're facing at the moment, which is really important. and that we kind of have to figure out how to live with and maybe make the best out of. But yeah, it's definitely an interesting time, and I think it's really great that we can have these events, even though it might be challenging at times. So thanks again for the invitation.
Thank you so much, Solveig. It was really nice to hear the story of UAEM, and I think it's UAEM has really a strong worldwide visibility, and it's mostly students and young professionals, so it really shows it is a great example of how youth voices can actually be listened. So now we might think that year 2020 is only the year of COVID-19, but actually it was also the official year of nursing and midwifery. And that's why we are very happy to have our two next speakers from the International Council of Nurses, so Erika Burton and Julián Vadell. I just want to share a very short story. So first, we were supposed to only have Erika as a speaker, and she kindly proposed to share the talk with her intern. So we are really in the middle of the topic of youth empowerment here. So Erika is a registered nurse since 2015. She's a senior advisor with ICN, so International Council of Nurses, Nursing and Health Policy Team. So she is also she worked a lot on sexual and reproductive health, and she holds a Master of Public Health from the London School of Hygiene and Tropical Medicine. So she will be discussing the nurses' role in health and social equity, COVID-19 response and mental health. And then Julián will link all these topics to the youth agenda. So about Julián, he is a doctoral student in educational sciences. He also has a master's in public health, and he is also a registered nurse. So he's working as a mental health nurse in Lyon, and he's also doing an internship at the International Council of Nurses. Thank you, Erika. It's your turn.
Thanks so much, Imane. Hi, everyone. I'm happy to be here. I'm speaking from Toronto, so I just want to acknowledge that I'm speaking from traditional lands. As Imane said, I am the Senior Policy Advisor at the International Council of Nurses since 2015. Unfortunately, or fortunately, I've been a registered nurse since 2010, which sort of exposes my age. But as Pierre-Antoine said, I'm very much looking forward to becoming decadent, so that's fine. I'm just going to share my screen here because I do have some slides. There you go. So you should be able to see that now. Perfect. So the International Council of Nurses, just for those of you who don't know, we are based in Geneva in Switzerland, and we're the voice of nurses all over the world, which is about 27 million nurses at this point. And that's from about 133 national nursing associations. And if you can see there in the orange, we cover basically corner to corner. It's the very first health organization, and we were founded in 1899. So decadent indeed. This year is the International Year of the Nurse and the Midwife, and what a year it has been. This is something that we could have not predicted. It has fallen sort of in a bittersweet way during the COVID pandemic, which has just shone a light on nursing and midwifery's role in global health and in healthcare systems, but in some ways, which I'll talk about in a second, that we would have preferred not to have. So nurses and midwives and other healthcare workers have been at greater risk than anyone else of contracting COVID-19. This has been due to a number of things. as you can imagine. We've seen these rapid increased demands on health systems, and we've seen nurses and midwives and other healthcare workers try to cope with that. Most of them were not prepared, and most health systems were not prepared to support them in this feat. So throughout the past, what has it been, 10 months, I've lost track, the health workforce has had a number of challenges. They've had the risk of exposure, which, as I said, is probably one of the highest. They've had extremely difficult working conditions. This is a picture of a nurse in Italy, which, as you know, is one of the first countries that was hit the hardest at the beginning of the pandemic, with lack of PPE, working long hours, few breaks, which is unfortunately sort of a reality of nursing anyways at the best of times. This has led to intense psychological and emotional distress, something called moral injury, which happens when we have an ethical duty and responsibility, both personally and professionally, to care for people, and that we're having to make care decisions that leave some people behind. So a lot of nurses and healthcare workers are experiencing this phenomena called moral injury. Fatigue, occupational burnout, stigma. We've had some reports around the world of nurses being victims of violent attacks. One nurse had a bucket of bleach thrown on her when she was walking to work in her scrubs. So the fear and the uncertainty that people are experiencing is in some instances being taken out on nurses. Just to give you a quick idea, there has been, we've been doing some research at ICN, and we've managed to only connect with about 44 countries. So this is just a snapshot. From those 44 countries, we know, I guess this is about 2 months old now, this data, but 1,500 nurses have died in 44 countries. And so to give it some perspective, that's the same number of nurses who died in World War I, and we're only some months into this pandemic. So if we look at our data, we think about 10% of healthcare workers are contracting COVID-19. And so if we look at the death rates versus the number that are contracting, it's probably closer to about 20 to 25,000 healthcare workers that we know of who have died from COVID-19. This is just a picture from our National Nursing Association members around the world. We have South Korea, we have Italy, and we have Iran. And these are nurses in the early days of the pandemic who were working tirelessly and sort of sending their photos in. So in this survey that we did, there were some key findings, very important in terms of sort of protecting the health workforce and making sure that we're around to do our jobs and adequately supported to do so. About 45% of NNAs report that they have compensation if someone is infected with COVID-19. And only about 48% of our national nursing associations report that COVID-19 is an occupational disease. So that means that when you're not recognizing something as an occupational disease, the compensation doesn't follow, but there's also no coverage for your leave, and not only are you sick in the moment, you know, there's some cases where they're sick for several months, and so nurses aren't being paid, and there's just not that recognition that this is something that needs support from the actual workplace. I am sharing this presentation, as Imane said, with Julián, so I'm not going to go through everything because I want to touch on several topics. But we looked at issues such as infection prevention and control, shortages of PPE, and psychological support as well. And then in response to this, one of our important roles that the ICN have been doing is just sort of trying to prioritize where we focus our actions and where our nursing associations focus their actions. And so very early on, we set out this call to action. And there's 12 items there on the slide that you see. And these are our top priorities, our top asks for governments, for non-governmental organizations, for intergovernmental organizations, and then for the WHO, so big bodies like this. And they cover pretty much everything that you've seen in the past, in the last slide, where we looked at sort of where the gaps were. A few that I want to point out is the numbers. So number 4 is implementing comprehensive surveillance and tracking. So we need data to be able to develop this infection prevention and control program. And we need to know exactly who is getting infected, where, and why. And a lot of countries were not collecting this data. So throughout the past year, we have been calling repeatedly on governments to collect this data so that we have these numbers, so that we know who is being infected and we can have these accurate reports. The other point that I wanted to look at as well is capitalizing on nursing leadership. So this is interesting, and this is where I think all of us are leaders at all levels. And, you know, right the way up from students to chief nursing officers. Capitalizing on nursing leadership will allow sort of our knowledge, our experience, and our closeness to the people who we're working with to translate into policy. And so that's something that ISTAN focuses on really heavily, is getting nurses into these policy positions, into leadership positions, so that they can use that real expertise and that connection to actually inform policy that makes a difference. And then the last one is learning from the COVID-19 pandemic to prepare for the future. So we weren't prepared, and we can see that very clearly in sort of the collapse of health systems around the world. And so something that youth can do, something that nurses, physicians, pharmacists, physiotherapists, all health professionals can do is take this and really try to integrate it into the work going forward, so that when this does happen in the future, and it will, we can be prepared. So very, very quickly on health and social inequities. This is a quote from the Deputy Secretary General, Amina Mohammed. She's extremely concerned. COVID-19 is a threat multiplier. So there's a health emergency, a humanitarian emergency, and now a development emergency in many parts of the world. We have seen, unfortunately, something that we always knew was there, but has really been exposed in COVID-19, are these social and health inequities that are profoundly and unevenly impacting mental and physical health, spiritual, cultural, and social well-being of people. And so COVID-19 has just exposed this and will quite likely make it worse. And this plays out in sort of a complex, multitudinous way and a cyclical way. So these populations are already unevenly affected by a number of health issues. And then those health issues we're knowing, like cardiovascular disease, mental health disease, are then exacerbated by COVID-19. Yet these populations are not being seen. The services are not accessible. And so these conditions are worsening. Healthcare workers, all of us, health and social workers, have a professional and social duty to advocate for equity and social justice. So just a couple of points on the screen. Human rights, values, personal choices, customs, spiritual beliefs of individuals, families, and communities have to be respected. As health workers, we're in a very respectable position to protect and celebrate and promote the diversity of everyone. And then we also need to speak out in the face of injustices. And I think that this is something youth are very, very good at and very strong at. And I heard someone earlier say, I'm young and I have energy and have, nothing to lose. And I think that that's absolutely the right energy to be able to do that. And in order to do that, I will say that I will tell each and every one of us to look inwards and challenge our own privileges and our own assumptions and our own biases, because then we can truly provide care and services that meet the needs of these people that we're ultimately serving. And And so the last thing that I wanted to touch on, and again, I'm so sorry that this is, I'm breezing through this, is mental health. So mental health is a cornerstone of health and well-being. And I bridge this generation, I was in the X and now I'm in the Y or something like that, the other way around, and they sort of expanded that. And so I'm at this interesting intersect where people older than me, were still very stoic. They still felt quite stigmatized to reach out and talk about their mental health. And then sort of the new generation is all about mental health, and we're really recognizing the importance and the impacts and speaking up about it. So I have no doubt in my mind that those of you listening right now know these words on this slide. But really just to give you a taste of what that means around the world, 1 in 10 people have a mental health condition. So that's around 792 million people. It's about 10% of the global burden of disease. And we're seeing anxiety and depression as some of the highest conditions. And so people with mental health disorders are also experiencing high rates of discrimination, which I just talked about very quickly. But countries aren't responding. So 2% of most countries' health budgets are spent on mental health, 2%. And in low and middle income countries, about 76 to 85% of people with mental health disorders do not receive any treatment at all, any care. And we have this lack. We know that in the year of the nurse and the midwife, by 2030, we need an extra 6 million nurses to meet the needs of people. And as the world gets older and our health conditions become more complex, that number is likely to grow. And so these mental health professionals at less than 1 per 10,000 people is just absolutely insufficient to deal with the number of mental health disorders and sort of well-being at the best of times that we need. 93% of the countries reported a disruption or halting during mental health services. So if you can imagine 1 healthcare professional in mental health per 10,000 people, now 93% of these conditions or of these services are disrupted during COVID-19. What does that look like? How does that play out in terms of people's mental health? 50% of countries have identified a mental health service in part of their pandemic plan. So we're still seeing that it's not a priority for governments and that it is put at the bottom. 50% is absolutely not adequate. So the nurses and other healthcare professionals have a massive role in mental health. This is the position statement that just came out last month, actually in October. I encourage you to go to our website and have a look at it. It really does speak to nurses, but is very, very applicable to all health professionals. We use the word nurses because that's sort of who we are. I've just pulled out, and you can read them very rapidly on the screen, some points that I think will apply to everyone here on the webinar today. And so recognizing that this patient relationship is foundational to successful interventions with people, and then sort of developing, like I said, that inward look, that therapeutic use of self to support this role is really important. Identifying and confronting stigma and determination and discrimination as a determinant of poor health and of marginalization is really, really important. So as you're there with patients, or if you're working in a policy setting, just sort of being able to really hone in on what is causing this marginalization, this poor quality of care, and really being honest with people and speaking up about what those things are. Reflecting on your own personal mental health, again, bringing it back to yourself and supporting yourself. So this has been a really, really tough year. And I really encourage everyone, if you can, and if you haven't already, to try to reach out for support when needed. And then I just put this one and it's the last point, and I'll hand over to Julián after. I put this one in because I knew we were talking about climate change, but our position statement does talk about the fact that eco-anxiety is an issue. And so bringing that up, I think, is quite new for a lot of people. I kind of had to push the more decadent folks into having this in the position statement because people thought, what the heck is eco-anxiety? And we're seeing it a lot. And we're seeing that people just knowing sort of this looming dread that our planet is in not a great state is giving people a lot of anxiety. And this sort of, we know that it's not an individual problem. We know that it's the big industries that are contributing to carbon emissions. And so it feels quite helpless and hopeless. And so this is a really important thing to think about when we're thinking about mental health. And plus, folks who live in island states, for example, small island states who are really experiencing the impacts of climate change in that their homes are being flooded, or Australia, their homes are being burnt down. That, of course, is leading to depression and anxiety and a whole slew of mental health issues. So something to think about as well. Follow me on Twitter and ICN on Twitter, and I'm going to hand over to Julián to link this, if you haven't already in your mind, to sort of the youth perspective. Thanks so much.
Oi, thanks, Erica. So here we go. Hopefully you should be seeing the presentation now. Are you seeing it? Yes, no?
Not yet. Now we see your screen.
Is it good now?
Yes, perfect.
Right. So, as Erica said, I am the intern of the International Council of Nurses. So what I'm going to present you right now is some kind of reflections on in what way nursing students and nursing novices are facing this kind of COVID era we are facing on these days, as well as in what position youth articulates on this era. And probably the first thing I'm going to present is something that you might have heard quite often. These are not my sentences. These are sentences I've heard for the last 6 months concerning youth and COVID. Not only for youth in general, but I have seen these sentences coming from healthcare workers and to young healthcare workers who are facing the pandemic. So when you see all of these sentences that we can agree they might be right, but we can agree as well they might be wrong, there is a question that comes to my mind, and this one is, can we blame youth for COVID? Probably the answer is no. So these kind of questions must make us reflect on in what position youth has been taken as responsible for a pandemic which is not theirs. Instead, is youth who is suffering more than any other generation the consequences of a global pandemic, because they are not capable, we are not capable to do what we were expecting to be doing on these days. And here is the fact. The fact is, in our concern, in the concern with nursing students and novice nurses, we have seen that these students have been called to work in intensive care units where there were plenty of COVID patients in the conditions that were not even safe enough for professionals. So you can imagine, if you are a healthcare worker and you are working on a COVID unit and you find yourself without materials, you know you are going to be exposed to some kind of danger. But imagine you are forming your nursing students, but you don't have the time nor the materials to provide security enough to them. So what's going to happen? Who's going to pay the bill? And most important, would you take the responsibility to let your student form in a condition like this? Especially when we know some of them have been recruited without the mandatory formation, without these materials, and sometimes for free or just underpaid because, you know, they are students, so we can ask them to do it for free. And what we see as well is we have this new generation of nurses, plenty of talent, who are coming for the first time to a nursing place. They are going to a hospital, They are going to a working place and they find they are in a COVID unit because there is no other option. So they have 24 hours, even less, to adapt to the new reality, and there is no other possibility because we are at the point in which the demand for healthcare workers is so big in all fields, but especially in nursing, that there is no other possibility for them to be on those units where they are asked to be. So there is no time for adaptation, there is no time for integration, and you have to do your job as best as you can since day one, hour one. And this exposes these new generations to new risks and to new risk factors that might at some point make them ask, why am I doing this kind of job? But what is most frightening, if you want, is we know these new generations are particularly touched by COVID. We know nurses as well as other healthcare workers are really touched by COVID, but there is no statistic on in what way COVID has touched the nursing students nor novices. This data is not provided by the Ministry of Health nor by the governments. So this has to make us reflect on what kind of transparency we want when we are dealing with a global pandemic like this. And you know, we were talking about nursing, but I think we can extend this to the other colleagues, to the other healthcare workers. Let's have a conversation on mental health, because imagine you are starting a new job, you have these perspectives of doing your job nice, just correct, and you find this situation, and you had to say, this is something no one was expecting. As Erika said, who would thought in 2020, where we were celebrating this year of nursing and midwifery, we would be facing this global pandemic? And this is particularly hard for youth, and this is because youth is the engine of our society. So we are saying our engine, just stop. You need to stop. It's for your good. Just pay attention to us and it's going to be okay. But at the same time, we are saying you are responsible for the bad things happening to our population. So at this point, we should ask, who's going to pay the bill of mental health for this population? Who's going to pay the bill for youth nurses, for young nurses, for novice nurses who are working every day, and when they arrive home, they see that whatever they do is not enough, that they are facing new confinements, they are facing new critics, that they are facing that the population is not understanding them. So that's the moment in which we should ask ourselves in what way we could give a hand, in what way we could just help the others, just taking a cup of coffee or tea with the other and just ask, how was your day? How are you feeling? Do you need some help? Do you want to have a conversation? This is important because we cannot allow ourselves to condemn generations of young health workers, of young professionals, of young nurses, because we have not been strong enough and courage enough to have this conversation. And you know, as Erika pointed out pretty well, I think, COVID has allowed us to face social inequalities that we knew they were there. But with COVID, we have realized they were bigger than we expected. And we are seeing how this is progressively increasing. So this is kind of a worrying thing, because we are seeing that it's not just only those low-income classes, low-income countries who are really having big trouble to pay their charges. We are seeing that middle-class population in most of the countries are not able to pay their charges. They are not able to pay even something to eat because they are not able to work because of COVID. So we are seeing that because of COVID, we are facing social inequalities, which are a source of marginalization, of isolation, of discrimination. As we as nurses, we have this responsibility to identify these situations and to provide help. We need to do it with associations, with the public institutions, with private funding. we need to give a hand, most importantly, for those who have nothing, for those who have lost everything during this pandemic. And there is no need for charity. We need to be clear. There is a need for investing in these low and middle income classes to ensure they have access to the essential standards described as the social determinants of health. I don't want to give just them money. I want to make sure they can reach the minimum standards of quality of life they deserve just for being a citizen of a country. And you know, it's important as a nurse to realize is our task. But we cannot forget nurses as well are at the risk of suffering these inequalities. So how we can protect our citizens, our population, if we are not able to ensure our own security? This is something that has to make us reflect on in what way nurses and other healthcare workers are present on our population, and in what way we recognize the job they are doing throughout these days. And you know, Erica pointed out the importance of gender, the importance of sexual and reproductive health and rights. What we are seeing, and this is particularly worrying as well, is because of COVID, we are seeing an increase of gender-based violence. And we are seeing that women and children are particularly concerned. This has been shown particularly in some Western European countries during the first confinement months. We have seen challenges that we were not facing before, situations that we were not expecting with people who normally we would have thought they would never have this problem. And what we are seeing as well is it's not only women and children who are concerned, we are seeing an increase of violence against the LGBT community. And facing that, at the first point, we have nurses. And nurses and nursing students, throughout their stages, internships, throughout their beginning of career, are maybe the first professionals who are just reporting this situation. So there is a need to have a conversation. And there is a need to understand that when we are facing these problems, we cannot step aside. We need to talk as a team with the other professionals, and we need to make sure these victims are able to find the help they need. This is a responsibility because we cannot allow ourselves to make the population pay a higher bill they are paying because of all of these risk factors provoked by the COVID pandemic. So just to make it short, this is a challenge of our generation, but I'm sure we will deal with it because, you know, every day we hear a lot of pessimistic comments. We hear a lot of bad news, of just horrifying news, and that's fair, but we need to be positive. We need to be optimistic, and we have the responsibility as healthcare workers to send this message of optimism. We will meet again, and it's going to work, but we need just to make it correctly, with the appropriate materials, and with time. And for this, we need to take into account the new generations in policy making. It's not because you are young, you don't have a word to say. You are young, your voice matters. So just knock at the door and say, here is my project. If they say no, just knock on the door, but don't step aside. If you think you are capable to just give a hand of this policy making. In terms of nursing students, we know it, but just, it's so clear, but just to make it sure, if we need to say this, it's because it's happening right now. In this era, more than ever, nursing students deserve safe practices and mandatory formation to face COVID. And if you see them, if they are your friends, your colleagues, and if you see they are not doing fine, just let's have a chat. Let's have a cup of tea. Let's talk. It's okay not to be okay, but we will manage it. And if we are able to talk in between colleagues, we need to be able to talk with our community. Because we know nurses contribute to the improvement of the social determinants of health, but they contribute as well to talk and to make projects to reach the point in which we can fight violence against women, children, and LGBT. COVID is not an excuse. We cannot let this happen in 2020. We have gone too far, and we have a responsibility. So, next year, still the year of nurse and midwifery, what if we just have a talk? Wherever you are, wherever you work, and we try to see in what way nursing students, novice nurses, can play for your community, for our community. Just let's share a conversation, but let's do it with the main goal, which is to improve our conditions, to improve the conditions of our society, of our citizens, and to face this pandemic that I'm sure we'll be able to win if we do it with the right way. Thank you.
Julián, thank you so much for your talk. So now we will start the discussion. We have a list of questions, and Lacye and me will be voicing those questions, and we will ask the speakers to be as short and concise as possible in their answers. Thank you so much. So I'll start with the first question that was asked on Twitter. So the question is, I think it is for you, Bitania, how can young people be meaningfully engaged at grassroots level to their sexual and reproductive health? How can they claim the spaces that decides for their health and well-being?
Okay, thank you. Thank you, Imane, and thank you all the presenters for the incredible experience sharing in all your sectors. So for that question, I think we have to focus on three things. The first one is government. We need to hold our government accountable for ensuring that there is space for young people in all factors, not just in health, but in all factors of life. So on the health, and specifically in the rural area, especially the grassroots, we have health extension workers that go door to door to ensure that people are accessing their health rights, and we ensure that youth corners, in partnership with these health extension workers, make sure that there are young people co-designing the processes with
Bitania, we don't hear you anymore. Okay, so she mentioned earlier that she had some connection issues, so I suggest to go to the following question, and we can come back to her later if she's back with us. Lacye?
Okay, so the next question is for Pierre. So it is really interesting how much the youth have made movements for climate change and how much that's shaping current society. So we wanted to ask you how the Young Swiss Network works for the inclusion of young professionals from all disciplines, since we need all disciplines involved in this work.
I'm not sure how to answer your question, because I mean the association is open to everyone and anyone who is interested in contributing to climate issues. So I mean there's a lot of students, but there's mechanical engineers, there's people who work in heating, ventilation, there's people who work in energy, people who work in biodiversity at IUCN, and I don't know by far everyone. so I don't really know how to answer your question. I mean, I think the determining factor is people's motivation to contribute. And I think profession has no kind of, doesn't really have an impact. Of course, people come from similar backgrounds because they have similar interests and they end up, you know, they have something that gears them towards climate action, some knowledge of, you know, the climate system, sustainability issues. But I mean, it's also very enlightening to hear you guys talk about, for example, mental health, because I said earlier there's some links between climate and and health, but I didn't think about that one. So thank you very much. Yeah, I hope that answers your question.
Thank you, Pierre-Antoine. Now we have a question for Solveig. So the question is, in a period when we are praising pharma companies and their work, do you think it is a feasible thing to think in a future where pharma would turn public? Also, when taking into account a universal health coverage perspective.
Yeah, so that's actually a really, really good point. Thinking about, I mean, I think it's all about a question of framing and a question of getting, I guess, the facts straight and figuring out what role the different players play. And when it comes to, you know, all of the praise that goes to pharma companies when investing in or conducting research and development of therapeutics, or I mean, the most current example is are the COVID vaccines, for example. I mean, the companies, they get huge praise for that, but then you have to think about where does the money come from, where does the initial research come from, and if you think about, for example, AstraZeneca, this is a company that was actually in close cooperation with the Oxford University in developing the first vaccine. So there was a lot of public money also going into the initial development or the initial finding of the vaccine candidate, and then afterwards also kind of thinking about who's going to pay for that afterwards. It's just a lot of public money that goes into that, and I think the whole discussion about it is also very largely influenced by you know, the PR of pharma companies. I mean, of course, I have a very strong opinion on this matter, but it is true that they have a lot of money that they can spend on publicity for their causes, and that kind of distorts the balance. It distorts the view on it, because it's not that they are the initial product usually comes from public research institutions, and then yeah. So I think yeah, it's a difficult question. It's just a lot boils down to transparency. It boils down to transparency in research and development. It boils down to transparency in pricing also. And I mean, just thinking about, like, if you think about the aspect of how can we have a bigger efficacy in conducting research and development, that would be through sharing IP and sharing research findings, instead of kind of trying to be the first one to to bring a vaccine to the market and be the first one to be able to sell it on a large scale. You know, agents buying up doses to ensure that their population will be vaccinated first. I think that's all kind of going in a large contrast to kind of these calls for global solidarity on trying to combat this pandemic on a global level and on a level that transcends borders, which would be actually much more forward-looking and much more, yeah, I guess, yeah, just more. I don't know what the right term is, but that, yeah, I think it's very important to try to combat it on a global level and with solidarity in mind. between different regions of the world. So yeah, I don't know if that really answered the question. I hope it gave some insight.
Thank you so much, Solveig, for that great answer. And so the next question is for Erica and Julián, both of you, or whichever of you wants to answer it. So you both talked a lot about COVID-19, but we know that nursing is much more beyond just being at the forefront of the pandemic. So what about all of those other nurses working in other areas that may not be getting as many resources now?
Yeah, I'm happy to answer quickly, and then Julián, you can add anything if you want. Yeah, you're absolutely right. So nurses are in every location that you can possibly think of, right across the world, and in rural and urban settings. So COVID-19, when we're at ICN, when we're talking about investing in nurses, it's not just investment in the nurses who are managing specific services for COVID-19. It's investment across the board. And I think it's important to note that we're seeing rarely sort of just COVID-19 specific services. Typically people who are, the most ill, or who are, have some sort of active disease process from COVID-19, also have a whole other number of either diseases or illnesses. And so part of sort of this integrated care model is that a lot of this care is being provided through, a variety of services. What is important is that separately from COVID-19, we still have all of the other health issues that we had before COVID-19. And so what we're seeing is a lot of these services are being disrupted. And because the resources, we just don't have enough nurses. So those resources are being put towards sort of COVID-19 focused services. So for a very good example is vaccine services. A lot of essential vaccine services are being disrupted because we just don't have the vaccinators to deliver these programs. So when we're calling for investment, when we're calling for, extra resources, it's really right across the board and not just focused on COVID-19 services. Julián, I'll let you add.
I think you said it all. So for me, it's okay what you said.
Great.
Thank you, Erica and Julián. Bitania, are you back with us?
Yes, I'm back, but I cannot guarantee that I will stay. I have a very shaky internet over here. But yeah, I can quickly respond to the question that you've already asked if there's no other question that's directed to me.
So actually, yeah, you can do that. Thank you.
Okay, so meaningful engagement of young people goes beyond giving them a voice. So empowers them to also tap into their agency that affects change. So it's twofold.
This is very unfortunate. I think we lost Bitania again. So yeah, I think we will stop the discussion here. We have many more questions that were asked, but unfortunately we cannot ask all of them. But we can also find a way to continue this conversation after the webinar. And now, Lacye, maybe you can introduce Arinze.
Thank you to all of the panelists who answered questions. It was really insightful and interesting, especially since you're all from very different disciplines and areas of work. So now I'm going to introduce Arinze Awiligwe, who is the president and co-founder of GHYPI. He's going to wrap up the event with just some concluding remarks. So Arinze has received training in pharmacy in Nigeria and has also studied global health and now currently works for Concept Foundation here in Geneva.
Thank you, Lacye. Thank you, Imane, for wonderful hosting, and it's been really insightful and enlightening, all the presentation from the speakers and the discussions as well. I can certainly say that I have learned a lot indeed. But just to conclude, I think we've said it all. I'm very excited about the enthusiasm and all the wealth of knowledge that we have all expressed during this discussion. And special thanks to all the speakers for taking part in this. I believe I'm speaking on behalf of everyone to say that we are very informed from your insights. Young people are often touted as the future. Oftentimes when we are in a table or in a room, we hear things like, we're the leaders of tomorrow, we're the future policymakers, or future leaders and all whatnot. But I beg to say that, we are the present, and there is no doubt about the fact that we have a crucial role to play in any health discourse. And I remember when we came with the idea of holding an event like this, one of the responses we got was, why are you talking about different big issues? Why are you all over the place? Why don't you just focus on nursing? Or why don't you focus on climate change or access to medicines or sexual and reproductive health medicines or in general? But I think we have, done justice to the fact that this approach is quite interesting, really just focusing on young people and youth voices, and the fact that when we all come together like this, in spite of our disciplines, and I think it's the point of global health, in spite of our backgrounds and our motivation, we are able to collectively contribute meaningfully to shaping the world into what we would like to see. It's no surprise that a lot of the improvements that we yearn for in health systems around the world, young people have really not been included. But today we see all of the many interventions where the youth prowess cannot be ignored. With the COVID-19 pandemic, we can continuously see how young people are inevitably needed to participate in very large means. And I think this is something that we will continue to work on as teammates at the Global Health Young Professionals Initiative. And I want to especially thank the team, Imane, Lacye, Morgane, Caterina, Charles, Mia, and everyone else who I haven't mentioned the names, Chris, Flaminia, for all your hard work in putting this together. And I hope we continue all this discussion, and I hope we continue to set the standard for ensuring that youth voices should, for whatever reason, not be ignored. Thank you, Lacye and Imane.
Thank you. And with this, I think we can close the event and keep in touch also outside this webinar. Thank you so much.
Thank you. Bye, everyone. Thank you all participants.
Thank you.
Thank
you very much.
Thanks for the organization.
Bye.
Bye.
Thank
Thanks
you.
so much.
Bye.
Okay.